Education. This is the final element as a physio, or the final element in your process. This has 4 important factors. Education is comprised of exercises, advice, prevention, and finally when they have to come and see you again. Exercise and advice have 6 different components to it. And if you are very serious about being a top-notch physio, if you're serious about getting the best results in the shortest period of time for your athletes, for your grandma, what I can share with you, you get these elements right. You want to have the exercises focused, okay? They need to be relevant. They need to be safe, okay? They need to have a dosage. They need to be time-based, and they need to have clear instructions. So what does that all look like? For someone who has a tight glute, okay? And we've treated the person, we've gotten a wonderful result, we've gotten a 30% improvement of lumbar flexion. We know that the main thing that makes a big difference was that glute, the tight glute. So what I tend to stress is, okay, I know that this person has lumbar flexion issues, but it was caused by the tight glute. Then the exercises become like this. The glute, I want to concentrate on the glute. Why is it relevant? Because by stretching the glute, lumbar flexion improves. And if lumbar flexion improves, then of course the person doesn't have any problems, their pain levels go down. How do I make a glute stretch safe? Well, by watching the person. Can they actually do the stretch at the clinic before they go home? How do they do it properly? There are a lot of factors involved in making sure a person is safe, but by making sure you do or check the person's, making sure you test that exercise before they go home is quite vital. Otherwise, say you are strapped for time and you can't actually show them at the clinic, give them strict guidelines. Things that they should do and things that they shouldn't do. Things that they should look out for if they're in pain or if they feel different things that they shouldn't be feeling. Quite vital. Dosage. Dosage is quite vital because with the gluteal stretch, you might hold a stretch for 30 seconds. Person A might only have to do it 3 times to get the result they want. Person B, you might find the gluteal muscle is way tighter. They need to do 6 repetitions. Now, you need to explain that, or you need to have the ability to explain that to your athlete and client. Because if you don't, if it's all very generic, it doesn't make a difference. And people tend to lose interest because it's not customized to them. So learn to customize it. Time-based. I've seen this missed out on by so many students that I've seen in the past. Personally, it took me a long time to figure this out myself, and once I did, it really helped me, because I would say, or what I would say now is, okay, you're going to do a 30-second glute stretch, you're going to repeat it 3 times, you're going to do it twice a day, morning and at night. Over 7 days, you're going to do that. Now, from day 7, so that's week 1. Week 2, you don't have to do it twice a day. You don't have to do it twice a day. You only have to do it once a day, and you only have to do it at the evening. And then week 3, you're going to cut it down to once every 2nd day. So why is that important? There are so many times where this is not explained. But what a person would say is, okay, here are the stretches. You're going to do these stretches 3 times a day. Or let's say you're going to do these stretches for 30 seconds twice a day. That's it. The person doesn't know when to start, what time of the day, when to stop. If you had the flu and you had some kind of chest infection and say you went to the doctor would say, here are 7 tablets, these are your antibiotics, okay? You're going to take 1 a day with food, and in 1 week you're going to come back. So the person is very clear about what they should and shouldn't be doing. And that is quite vital because it's very black and white to the person. All of this makes everything very black and white for your patient. Clear instructions. Having clear instructions is so crucial. It takes away the grey areas, it takes away those problems that these people might even consider, and it just allows for you to be a better practitioner. It allows for you to do the job that you have to do. Meaning, you've done the subjective, done the objective, analysis, treatment. As part of exercises, this person's going to go home and pretty much do everything that you want them to do because, once again, you're the expert, you're the professional, you're the scientist, okay? And you have now been able to say, these are the things that you should be doing, these are the things you shouldn't be doing, these are the exercises that are helping, and these are the exercises, or these are the things that you should look out for when you're doing the exercises. So these 6 things, when it comes to exercises and advice, very crucial.